name is Jessica Simmons. I'm going to be your nurse today. What is your name?
Chris.
Hi, Chris. Can you give me your first and the last name and your date of birth?
Christopher Simmons, August 2nd, 1987.
Nice to meet you. I'm going to be interviewing you today for your physical and health assessment, and it'll take about 5 minutes.
Perfect.
All right. So can you tell me how you're feeling today?
I'm feeling good.
Great. Awesome. Any complaints that you have?
No.
Everything's feeling good?
Yeah.
All right. Can we talk about your history a little bit?
Sure.
All right. So you're up to date on your immunizations?
I am.
Right? Okay. So do you drink alcohol?
Socially.
Socially. So a couple times a week?
Couple times a year.
Okay. How about smoking?
No. I don't smoke.
Okay. Do you use any other form of tobacco?
I vape.
Okay. How often do you do that?
Daily.
Daily. Okay. Do you have any issues with your
With my what?
Wait, just pause. Okay. I'd like to go over your family history. Is your mother alive?
She is.
Okay. What is her health history?
She is pre-diabetic and she has had breast cancer.
Okay. Any blood pressure issues?
High blood pressure.
Okay. And never been on any diabetes medication?
No.
Okay. Not that you know. How long ago was her breast cancer?
Let's see. I'm 36, so 18 to 20 years ago.
Okay. And then let's talk about your dad. What kind of history does your dad have?
Well, he's passed away.
Okay. And how did he pass?
From a heart attack.
How old was he?
62.
Okay. And did he have any health history?
None that I know of.
Okay.
He was a smoker, though.
Okay. Okay. And then your paternal grandparents. Do you know much about them and their health history?
I know that my father's mother was diabetic. I don't know about my grandfather on my father's side.
Okay.
My grandfather on my mother's side died of lung cancer. And my grandmother on my mother's side is still alive.
Oh, wow. Okay. And what about her health history?
I know that she is diabetic.
Mm-hmm.
And she has had cancer before, but she's been in remission for a very long time.
Okay. So it sounds like diabetes runs in your family on both sides.
It does.
Okay. All right. So let's talk about your personal history. Have you ever been diagnosed with anything?
High blood pressure.
Okay. Are you medicated?
I am.
And what do you take daily?
Valsartan.
Okay. Do you know the milligrams?
Nope.
Okay. And you take that once daily?
Yes.
Okay. Are you taking any other medications, including over-the-counter medications?
I take supplements.
Which are?
I take a multivitamin, I take magnesium, and I take ashwagandha.
Okay. All right. Do you use any illicit drugs?
No.
Okay. And you already stated that you rarely have alcohol, that you do consume tobacco products in the form of vaping. Have you smoked cigarettes before?
I have.
Okay. How long did you smoke cigarettes and when did you quit?
I smoked cigarettes for probably 12, 13 years, and I quit 3 years ago.
Okay. The next question is uncomfortable. Are you sexually active?
I am.
Okay. And how many partners do you have?
One.
Okay. Any history of sexually transmitted infections?
No.
Okay. All right. Let's talk about exercise and your diet. Do you exercise regularly?
I try to.
Okay. And how is your diet in your opinion?
Not the best.
Okay. So you want to kind of improve on both diet and exercise.
Yes.
All right. especially with your family history of diabetes.
Yes.
All right. And your surgical history. Have you ever had a surgery before?
I had reconstructive nose surgery.
Really? How
Yeah.
old were you?
17, 18. Okay.
What happened to your nose?
Football, and I happened to get into a fight.
Okay. Do you have any issues with your breathing now?
No.
Okay. And then we already discussed your medications. How about your education? What is your highest level of education completed?
Bachelor's degree.
Okay. And when was that?
2010.
Are you employed?
I'm self-employed.
Okay. How long have you been self-employed?
7 years.
Very nice. Okay. And what do you do for work? And how many hours do you work a week?
I am a Medicaid waiver provider for individuals with developmental disabilities, and I work on average 40 to 45 hours a week.
Okay. All right. That sounds very nice. So how do you feel about your current level of health?
I feel okay about it. I just need to eat a little better, be a little more active.
Okay. All right. I think we all kind of feel that way.
Yeah.
All right. Do you enjoy life?
I do.
Good. That's really great to hear.
I do enjoy life.
Well, listen, Christopher, it was really nice to meet you.
It was a pleasure.
Thank you, sir.